to Health Matters on Fubu TV, your one-stop educative show that gives you all the tips you need to stay healthy and live right. I'm Sarah Jimmy, and I'll be giving you all the tips you need to stay healthy and keep fit. And of course, a health tip a day keeps you healthier the next day. So today's edition of Health Matters, we'll be talking about one of the most deadly and common diseases in Nigeria and the world at large: diabetes. Diabetes mellitus, commonly known as diabetes, is a chronic disease that occurs either when the pancreas do not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates blood sugar. Hyperglycemia or raised blood sugar is a common effect of uncontrolled diabetes and over time leads to serious damages to many body systems, especially the nerves and blood cells. There are different types of diabetes. We have the type 1 diabetes, type 2 diabetes, pre-diabetes, and gestational diabetes. Dr. Alero, a public health expert, explains the different types of diabetes.
We have type 1 and type 2. The type 1 is more common among younger age group, and the type 2 is common among the elderly. As you advance in age, people are at risk of the type 2 diabetes mellitus. The diabetes mellitus, most of the time, the type 1 is when you don't have the insulin, which is the chemical, let me use that word for easier understanding, that is supposed to take glucose from the blood to where they are needed, to other organs like the brain, the liver, the kidney, GIT, muscle, where they are needed. So when you don't have that insulin at all, it's what we call the type 1 and diabetes mellitus. But the type 2 diabetes mellitus is when you have that, but in small quantity, in a quantity that is not sufficient to take the blood glucose to where they are needed. So, and that I say we see in older age group as you advance in age. And when you have that, you now start, the person starts experiencing symptoms like weight loss. Some people have weight gain, depending on the type of diabetes. And you can also have waking up at night to urinate, getting tired, taking a lot of water, and so on and so forth.
There are different symptoms of diabetes. Amongst these are the general symptoms: increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that don't heal. The symptoms in men are quite different from the symptoms in women. Symptoms in men include a decreased sex drive, erectile dysfunction, also known as ED, and poor muscle strength. Symptoms in women include urinary tract infections, yeast infections, and dry, itchy skin. Diabetes has many complications. This is because high blood sugar damages organs and tissues throughout your body. The higher your blood sugar is and the longer you live with it, the greater your risk of complications. Complications associated with diabetes include heart disease, heart attack and stroke, nephropathy, vision loss, hearing loss, foot damage such as infections and sores that don't heal, skin conditions such as bacterial and fungal infections, depression, dementia, and the rest.
And the complications of diabetes mellitus, it's better prevented than allowed to even occur, because they can have stroke. Yeah, people with diabetes can have stroke. When you have stroke, of course, you know, their quality of life will be affected, and even their life expectancy too will be reduced. So they can have stroke, they can have kidney disease, they can have eye problems. So the complications are a whole lot, and it's better prevented than allowed them to occur.
Healthy eating habit is a central part of managing diabetes. In some cases, changing your diet may be enough to control the disease. Dr. Alero expatiates more on the different diets to take as a diabetic patient.
And some of the ways you can prevent diabetes, one is to take healthy diets. Take a lot of foods that contain high fiber contents like fruits, vegetables, and so on. Then the fruits should be like 5 servings in a day. 1 apple is a serving, 1 orange, you know, you take that like 5 times in a day, not just once and you say, oh, I've taken fruit. No, at least different types 5 times in a day. You can take all kind of fruits, watermelon, oranges, apple, the likes, depending on the season and the type you want to take. Then also taking a lot of vegetables. You know, we are blessed in this part of the world. We have a lot of fresh vegetables that are seasonal. So you have different types at different seasons. So taking a lot of them, so like 5 servings. So you take a lot of vegetables. That is also very important when you're trying to prevent diabetes.
There are so many ways to prevent diabetes. The type 1 diabetes isn't preventable because it's caused by a problem with the immune system. Some causes of type 2 diabetes, such as your genes or age, aren't under your control either. Yet many other diabetes risk factors are controllable. Most diabetes prevention strategies involve making simple adjustments to your diet and fitness routine. If you've been diagnosed with pre-diabetes, here are a few things you can do to delay or prevent type 2 diabetes. Get at least 150 minutes per week of aerobic exercise, such as walking or cycling. Cut saturated and trans fat along with refined carbohydrates out of your diet. Eat more fruits, vegetables, and whole grains. Eat smaller portions. Try to lose 7% trusted source of your body weight if you're overweight or obese.
Physical activity, because we know that excess weight gain is also related to diabetes. So you need to be physically active. You don't have to sit down in a place for a long time. So we have to discourage sedentary lifestyle. So we look for avenues to take to indulge in physical activity. So we tell people to walk instead of taking their car. Sometimes you tell them to walk, brisk walking, bicycling, going to the gym, swimming, you know, dancing, as simple as dancing with your children or loved ones, or family at home, at least 30 minutes in a day. That's the WHO standard for moderate physical activity. Then apart from physical activity, also encouraging people to stop smoking, tobacco usage. You want to tell them to stop taking tobacco as much as possible because they've been linked to diabetes mellitus. Also, alcohol consumption, harmful alcohol consumption. They said if you take small quantity, it's good for the heart. Maybe take it too much. If you take it too much, it can also affect the heart and also other disease conditions like diabetes and hypertension. So you want to tell people to reduce alcohol consumption, take the quantity that is not harmful to their body that can protect them for having disease conditions like diabetes mellitus. Then also you want to tell people to screen. Like I said, diabetes can run in the family. So, and as you advance in age, you are at risk of coming down with diabetes mellitus. So we want to encourage people to at least always try and check their blood sugar, what we call the fasting blood sugar.
Above all, your family, environment, and pre-existing medical conditions can all affect your odds of developing diabetes. So it is advisable to just eat right, as it is said that prevention is better than cure. And that's all we have for today's edition of Health Matters. I still remain Sarah Echeme, and I do hope you learned something new and new health tips on how to stay healthy and fit. So, till then, stay fit, stay healthy, and eat right. Bye-bye.